Performer. I am the owner and manager of Body Logics. What we wanted to do as a company is we wanted to start sending out videos to our current patients and clients to help them in these times where they're not able to come see us, and to get them to understand a little bit more about what might be happening with their bodies if they're suffering from pain. We're seeing a lot of videos which say about exercises you can do at home, but if you're suffering from pain, it can sometimes be a bit worrying to understand what you can or should and shouldn't be doing if you are suffering with any pain or discomfort. So the first thing we want to look at, and the reason why I'm holding the spine, is the generic back pain. We obviously see a lot of people with that and are able to treat it with a lot of hands-on stuff as well, but we usually always offer exercises as well which can help prevent that pain come back. So the treatment within clinic usually helps to manage that initial pain, and the exercises will then help it to get better long term. Now, we can't do the hands-on stuff, but we can certainly give you some advice and some guidance with some exercises. Now, we do online appointments at the moment, which go into a little bit more depth and take a little bit more time to understand your history and what's happening. So this, you have to consider or appreciate this is very generic information, but most of the time it's going to be quite useful for you to take away and utilise yourself. Now, we get a lot of people asking, why does my back hurt now? Or why does it hurt first thing in the morning especially? Now, this spine here, you can see these little disc things in between the coloured discs. These gel-like discs are filled with loads of nutrients, and that's what keeps the spine healthy and supple and able to move. Now, usually what they do is throughout the day when we're moving and placing weight on them, we're compressing them, we're squeezing out fluids, and then we're replenishing it with other nutrients to keep things healthy and ticking over. Now, I'm going to take a guess here. Now, if you have back pain, usually you'll feel it most first thing in the morning when you wake up, or when you stand up from a prolonged period of sitting. If you imagine when you're sleeping and you are in this position, these gel-like discs are not having any compression on them, and the fluids within them become stagnated. And that stagnation of fluid is then what leads to that feeling of stiffness and the lack of healthy juices as such, which are in there to keep things nice and smooth and mobile and healthy. So when we wake up first thing in the morning, we feel that stiffness, and then about 30-45 minutes later, we start to ease up because we start moving around. Same thing happens if we sit down. We're sitting down, we feel that pain, that discomfort, and we feel that pain and discomfort because things are stagnating. We stand up, and then it starts the fluids start moving around, and we change in old nutrients with new nutrients, and that therefore keeps it nice and healthy, and things get back to normal. So that's a really, really brief overview of what you can do to help yourself if you are feeling stiff and in pain, and not immediately think that it's a disc bulge or a herniated disc, or you've slipped a disc, or sciatica, any of them things like that. It's highly unlikely for it to be. There's loads of ways that you can tell if it is neural. It takes a little bit more of an in-depth assessment to do that. So that might be something you want to consider if you do think it's that. But my first bit of advice would be try the movement, get things in here moving about. It doesn't need to be big drastic actions. It can literally just be getting up and down for a walk around the house to try and get them fluids moving or the nutrients moving, and see if that makes a difference and helps ease it off. Over the coming days, we're going to be posting more videos about certain things you can do if this here doesn't work, for example, and some self-treatment ideas and some really simple exercises you can do specifically to help manage pain. And we're going to give you the science and the research behind it, so you can understand exactly the reasons for doing it. So keep a lookout for us, and we'll see you soon. Thank you.